YouTube. And so excited about this opportunity to engage with our District 6 residents and others in this new platform. We have a number of topics that I'm sure folks are interested in, and we can't cover everything in one live stream in one 1 hour session. So we're going to take it piece by piece. And today the focus is coronavirus, COVID-19, and specifically updates, ways that we can best protect our community, specifically focusing on East Oakland, where we represent District 6. We have I'm excited to have some exciting guests here today to really help us dig into the topic, provide some thoughts, perspectives, experience, and just understand the great work that they are doing with their organizations. So one thing I wanted to do just to set the tone, since this is our first live stream, wanted to provide a little bit of background for those who are maybe a little bit less familiar with District 6, the district I represent in City Hall. District 6, we have, I would say, the best of Oakland here, but we also showcase some of the challenges that Oakland faces as a city as we attempt to grow, develop in a way that brings everyone along. We've been plagued with a lot of the challenges that have resulted from systemic racism, redlining, other factors that have really left our communities starving for resources, starving for needs. We don't have a single retail bank in District 6, and other amenities that most people take for granted that they have in their neighborhoods. And as we look at those challenges, as we look at the disparities we face with economic disparities, health disparities, others, that can be exacerbated by a crisis like the one we're facing, COVID-19. And that's one of the things that I, along with so many others, are working to help make sure it doesn't happen. So we've got some amazing resources and amazing people in District 6 that are really going hard for our district, going hard for the community, for our city. And we've got a couple of those who are showcased here today with us. I'm going to, I think we have Dr.Noha Aboelata, who is already on the screen, and I'm going to try and add CJ, Carolyn Johnson, into this as well. Hopefully this technology works. CJ, we've got you in as well. So I want to introduce and acknowledge the two of you, phenomenal women who are doing amazing work in our city to make sure that those who are most vulnerable, those who have traditionally been left out and under-resourced, are being taken care of. And specifically as it relates to COVID-19 and coronavirus, making sure that we don't lose ground, that we don't exacerbate the disparities that we have been facing. And we actually even can gain some ground by being very proactive and leading edge. And so with that, good morning. Good morning to each of you. Let's do the sound check. Dr. Noha, can you just say hello quickly so that we can make sure the sound is working?
Sure. Good morning. Thank you so much for having me.
Great. Absolutely. And CJ, you sound check?
Sound check. I'm here. Good morning.
All right. Good morning. Good morning. So obviously there's a lot going on. There's a ton of information out there. And I think one of the challenges we have, on one hand, folks are challenged to just get information in the first place. On the other hand, folks are challenged with so much information coming out, knowing how to filter through that and really understand what's most needed and what they should focus on. And so I'm excited about this opportunity where we can hopefully distill some of those key nuggets that folks should really be paying attention to, so that they can know how to better protect themselves, their families, and their community as we go through this crisis, both from a health side and from a economic side with respect to the finances and other sort of resources there. With that, why don't we start with something a little bit, maybe not going straight into the details, but this is Mother's Day weekend. So first of all, happy Mother's Day to the two of you, I just maybe we'll start with how are you planning on celebrating, or what are you looking forward to this weekend? We'll start with you, Dr. Noha.
Yeah, I don't know. I'm going to try to get some relaxation, and my family has told me to stay in bed after I wake up. So I can guess, but I don't know exactly.
That's, sometimes it's much better that way. Absolutely. That's great. CJ, anything that you're aware of or that your family has made you aware of yet?
Yes, I have a deadline of 11:30 for a brunch. My brothers every year, they make breakfast for the sisters and the moms. And then tomorrow I plan to hopefully do nothing. So if you see me on the computer, tell me to get off.
Well, we will definitely do that. I'll be your accountability partner for that one.
Thank
For
you.
sure. Stay offline. Enjoy your day tomorrow. Absolutely.
Yeah.
So with that, I know that we have with the information that's coming out. Oh, I guess I should maybe give you a little bit of what we have going on as well. So absolutely, Mother's Day is a sort of a big deal. Since we are doing the shelter in place, my kids haven't had the opportunity to actually spend time with their grandmother as much. So we will likely be doing a social distance drive-by where we keep some distance, but still have a chance for them to see her. And at the same time, definitely celebrating my wife. And so I think we will be supporting one of our local restaurateurs by instead of me cooking, we'll take advantage and support the local economy by having some good food sort of brought in. And I guess shout out to Chef Lala with Just Law Catering, who we're going to be taking advantage of there. So with that, let's go ahead and jump into the I guess the discussion around coronavirus and COVID-19. We recently had the governor made a statement this past week that on a statewide level, we will be relaxing some of the shelter in place guidelines, while within Alameda County and Oakland, Alameda County, and then 6 other Bay Area counties, there was a follow-up statement that said, despite what's happening at the state level, we, through the order, are given the ability within the county to make our own decisions as to what is taking place. And we think that it's best to continue our shelter in place for the time being. So we are still in effect with the same sort of shelter in place that was ordered May 4th. So earlier this last week, actually. And so with that, we're still looking at and planning for a lightening and lessening of the restrictions, and everyone's excited about that. I know if you're sheltering in place for 7-8 weeks, it's you're getting pent up. I'm feeling it. My family's feeling it. I'm sure you guys are as well. And so, wanted to begin with just the sheltering in place from your perspective, your organizations, the constituents you serve. How are you seeing the shelter in place, the impact, and what are your thoughts as far as opening up as we look to opening up the restrictions and loosening the restrictions? What needs to be in place? What things should our residents be keeping in mind as we do it, as we adhere to existing shelter in place, but look towards I guess getting out and engaging more with each other, with social distancing and other things in mind. So that's the I guess the first lob, and I'll also give you guys an opportunity to give a little bit of background on your organization as you answer that question. Dr. Noha, do you mind kicking that off?
Sure. So I'm the founder and CEO of Roots Community Health Center, and we are based in Deep East Oakland with sites at 99th and East 14th and also 73rd and MacArthur, as well as youth shelters, clinics within the youth shelters, a mobile clinic that goes out to Oakland's encampments and provides mobile medicine. We also do quite a bit of street outreach and navigation, workforce development. We have 2 social enterprises, Clean 360 and Hamilton Broadway Signs, where we have workforce training programs that also sell products, and that's a big part of our mission to create equity and to eliminate disparities and really to uplift those who have been impacted by systemic inequities and poverty. And so that's the work we do, and that's the community we serve through primary care and behavioral health and all the wraparound services that I mentioned. I'm really grateful to be in Oakland and I'm born and raised in Oakland. I'm from Oakland. But to be here in this moment, in this time, to be here with the leadership that we have, and in the Bay Area with the region really taking a stand and coming out first with the shelter in place. And I think it's the reason why we're doing relatively well in terms of this pandemic and the peak and so forth. I don't think we have any reason to believe that we're ready to be relaxing anything. And so I will say that, of course, the shelter in place is having a tremendous impact on folks economically, in terms of people's mental health, in terms of dynamics within households, in terms of students learning. All those things are huge. And so in no way would I ever want to minimize those impacts. But strictly speaking, from a health perspective, I don't think we are ready to be relaxing those standards. I think there's still a tremendous amount of concern out there about transmission, about a next wave, and who that next wave is going to impact will most likely be our communities.
Thank you for that. I appreciate that perspective as the health professional, knowing the impacts that being too liberal could be in relaxing restrictions. We know that the impacts of health disparities in general, whether it's diabetes, asthma, cardiovascular disease, they have disproportionate impacts on the Black and Latino communities. And in District 6, 85% of our residents are Black and Latino. We have seen significant sort of disparities just so far with contracting the virus and the impact of the virus in our part of the city, our part of Oakland versus others. And so I think what you say needs to be taken to heart as we look at how we engage with each other, how we sort of adhere to the guidance that has been laid out. So thank you for that. CJ, what are some of your thoughts, perspectives? What are you seeing on the ground, and any high level sort of messaging that you think is important to get out to community members?
Yes, thank you so much. I'm the executive director of the East Oakland Black Cultural Zone Collaborative and a director of the Black Cultural Zone Community Development Corporation. And the Black Cultural Zone runs from High Street to the San Leandro border of the city of Oakland, from the hills to the water. And our purpose is really to hold place for Black people and Black businesses and create a thriving community in East Oakland for its legacy residents. And so when I think about reopening, I think about the fact that we did not press pause for businesses. They still have to worry about their rent, their employees, and their staff. Pressing pause would have been a great thing for everyone while this pandemic hit and we had to shelter in place. But since that did not happen, we have to continue to resource our businesses and entrepreneurs, our artists and our makers, to go ahead and fulfill their financial obligations, those that they cannot fulfill. We need to find ways to help them try to forestall some of those obligations, because the reality is when we're asked to close but not given the resources to fund that closure, that leaves us at a deficit. And particularly for Black and Latinx businesses, it's more of a deficit where we're behind the gun as well in terms of economy. As we are with health indicators, we have lower net worth, lower access to capital, lower access to markets and marketing. And so until we're able to lift those things up now in this pandemic, and after that, we are going to fall prey to that again in this second wave. And so I think it's important because we've not closed as we begin to reopen, to make sure that we are giving them access to those resources that we're helping some businesses get market ready, which means that if you didn't have a virtual presence online, the new world will be where a bigger portion of your income will be virtual, will be online, will be deliveries, will be pickups. And so we have to get our businesses ready for that in the short term. But there's a lot of preparation and elevating of capital readiness for businesses and awakening our policymakers, our politicians, our funders, how unbanked our communities are for as residents and as businesses as well. And we have to change that if we want to have a vibrant economy that includes all representations from all groups. So that's the first concern, is getting market ready, getting capital access, getting immediate resources, and really thinking about how do we support businesses that have been forced to close and lose a substantial amount of revenue without resources. I was looking at something the other day. It said that the likelihood of a Black business getting the PPP loan, for example, or getting rejected for it was 95%. For Latino businesses, it was 92%, which means it's more likely that they did not have access to this really surgically defined PPP resources and federal resources, and therefore they are further behind the gun. And so we have to hold people accountable for how we make sure that federal, state, county, city, local, private resources are available to help reduce the inequity that exists in the past and is being exploited now in this present time.
Thank you for that, CJ. Absolutely great work that you're doing. I know that you are working in partnership not only with my office, but also with our city's Economic and Workforce Development Department, with foundations, philanthropic foundations, with private enterprises, trying to pull together all of those resources in a way that really is targeted towards supporting those most vulnerable businesses. And we know we have a lot in our area, especially when we look at the fact that we have such a, I would say, limited economy to begin with, given where we are in East Oakland and some of the challenges that we face. So thank you for that work. Absolutely. One of the things that was mentioned, and I'm sort of cognizant of the questions that are coming in. We have a few that we're going to be addressing specifically. One of which looks at the food resources. I read, will food resources continue to be available to families that are struggling over the summer? How will families be supported in protecting their children when school gets out? So that is, and that question speaks to a fundamental aspect of this coronavirus response. Is we've got immediate needs relative to health, the health education, the awareness, the information on how people should engage, what should be done. There's the immediate aspects of health with respect to, do we have the right equipment, personal protective equipment, masks, et cetera, and the testing that's needed. And there's the immediate aspect of like how you get treated. So immediate health concerns are one. The other immediate need is around those basic needs of food, shelter, those things that if we don't have our job because our workplace had to close down, shelter, if we don't have these other things, how are we able to make sure we're putting food on the table and keep a roof over our heads? And so that's what this question gets at. I did want to address the bigger picture is that we do have a number of sort of food distribution resources that are out there that we want to make sure everyone's aware of. And so hopefully in the chat, some of my team members will be putting some of those links in, but we do know that the city of Oakland is doing meal distribution at the 81st Avenue Library on Mondays, Wednesdays, and Fridays. And those are, I believe it's from 12 to 2 p.m. And so we want to lift that up. We know that there are other organizations that are doing food distribution, meal distributions as well. The East Oakland Senior Center, every Wednesday morning, they have a produce food distribution, bags of groceries and produce that are available. We also have the Homies Empowerment Project, which is on 77th and MacArthur Boulevard in District 6. They every Tuesday are doing a food distribution along with a warm meal, a hot meal, along with a sort of bag of groceries that goes along with their market, where they basically have a free market of other goods and needs that are available. And we've got a few others that are all available, and you can find the list on the City of Oakland's website, the COVID-19 website. I know that you guys are involved in others. We've got the East Oakland Collective distributing food to our homeless encampments. The World Central Kitchen is a great partner. They are actually helping to raise funds that then get used to basically pay restaurants that had to close to create these meals that can get then distributed out. And so it seems like there's a lot of effort there. To directly answer the question that was raised, my understanding is that there is we are continuing to work with our nonprofits and other philanthropies to provide these food resources well beyond the, I would say, relaxation of the shelter in place, because we recognize that need is there. So and we'll continue to spread the word and make sure that those things are uplifted. I don't know if CJ, you or Dr. Noha have anything else to add, because I think you each are involved in other aspects of supporting food scarcity.
Sure. Yeah, we've definitely increased quite a bit the amount of food distribution that we're doing. It's about quadruple from what it was prior to this pandemic, just because folks who were food secure have become food insecure. And so that is something that we distribute grocery bags. We also distribute hot meals, particularly to our unsheltered population, and also do food box deliveries to our seniors and folks with more complex medical conditions that we really don't want them to leave the home. And so that's something that we have done. I think one of the blessings in this crisis is a lot of partnering. And as you mentioned, World Central Kitchen and the restaurants, and just sort of matching that unused capacity with restaurants that had to close with need. It's been good to see that those connections kind of materialize. And so I would just say, yes, we need to continue with the schools providing services over the summer. So I'm hopeful that that will happen. But also all of these connections and partnerships that have emerged in East Oakland in order to address food insecurity in this time, I hope will continue after this current crisis is over.
Absolutely. Thanks. CJ, anything to add?
Yes, we're excited that we're going to be helping to support another hot food distribution at the Eastmont Mall site that we were able to work with the city on with World Central Kitchen, and also right across from Roots Health Center, and that should be starting at the end of May. And I also think that we should think about how we can engage the Yelps of the world, the Postmates, the Uber Eats that are all doing really well, so that someone can be able to log on to their websites and identify places where they can get delivered free food or they can find free food. So these are the gaps that we try to see and organize. It will be great to engage them in that way, so that anytime you want to find a testing location or a place where you can get food, breakfast, lunch, or dinner 7 days a week, it'd be great to find a way to activate that so folks can log on or use an app or something like that. So I'm hoping that's something that we can also help to sort of elevate as well.
Absolutely. Well, that's great to hear. And I know that we listed a number of resources that are available and can be found on the city's sort of COVID-19 website. If you go to oaklandca.gov/COVID-19, then you can find that information. I guess the other thing I wanted to lift up and acknowledge is that as we are looking at the basic needs, the city, the question was raised regarding the schools and what happens after the school's out. And the city of Oakland, through the Parks and Rec Department, has traditionally supplanted the breakfast and lunch program that the Oakland School District has offered or provided. So I know that will continue as well. With respect to schools, another question came in related to distance learning and the recognition and the reality that distance learning is easy for certain communities, for certain families, as opposed to others. I think specifically the question is mostly due to disproportionate access to resources. we see these disparities. What are you doing to support families in accessing learning for their kids? What will be done to manage the amount of regression that will inevitably occur? That is a real concern. That's a real reality. And unfortunately, in District 6, we see a significant amount of an achievement gap and sort of challenges with respect to the public schools and the outcomes that we see normally. Now, with this 2 months of not having school at the end of a school year, that can only, we see how that will exacerbate those educational outcome disparities that exist. And so it's great. I would say the school district has done a number of things that I believe are helpful in addressing these challenges. There has been an effort to get technology, Chromebooks, out to those families that do not have access, and also the acquisition of the hotspots, the Wi-Fi hotspots, so that that can be extended as well. There are a number of factors that go in to supporting our students beyond just the technology. And I want to acknowledge our teachers now during Teacher Appreciation Week for really stepping up and going above and beyond in terms of ways of engaging our students in ways that they haven't had to before in this new reality. All of that being said, we still have gaps. Those gaps will persist. I don't think anyone can deny that. And so I have this conversation with our school board representatives and with the administration to really discuss and figure out ways that we can support. I know that there have been conversations around supplemental instruction over the summers in order to make up the gap, as well as some other solutions in place. Though that's what I'm aware of, we will continue to engage and support that, I guess, those conversations to make sure that our students aren't being left behind and that our parents are supported in how they educate their students as well. I see a question related to help for homebound people of high-risk groups who need lab work. People with issues like diabetes need labs drawn to manage their conditions. Are there visiting nurses available? I don't know, Dr. Noha, do you know anything about those resources?
So the county has some level of visiting nurses, but for lab work, I think that the best option is really to work through your primary care provider. Most of the, so like Alameda Alliance for Health or Anthem Blue Cross, the different plans and providers, they should be able to deploy phlebotomists that can go out to the home for lab work specifically, but it would need to be ordered by the primary care provider. So now in general is a really good time, I think, to be connecting with your primary care provider and to be doing phone visits or video visits. The telephone visits really work quite well for a lot of our patients. Of course, all of our sites are open, but we're really encouraging only sick visits to come in and people who want to be tested for COVID. Routine visits, refills, all those things are being done by phone, and we're able to order lab work by having the lab company actually go to the home. So it's not visiting nurses per se, although there's some availability for that. But for the most part, it's really best managed, I think, telephonically with your provider. So certainly this is not the time to be running out of blood pressure medication. This is not the time to run out of your inhaler or your diabetes medication. This is a great time to get equipment in your home, like a blood pressure cuff or a glucometer if you don't already have one, so that you can do a little more self-monitoring. And these are things that we always encourage, but particularly now where you don't want an ER visit. You don't want to have to go encounter the medical system if at all possible to avoid it. And so I think this is a great time to kind of shore up any chronic medical conditions and to do phone calls with your providers. I know at Roots we are doing our diabetes group visits. We've moved them into a virtual platform. And so that has been really great actually, to be able to join by phone and talk about diabetes self-management. And so I think self-management has always been such an important part of what we like to encourage and teach. And I think now is a really great time to kind of improve that and bolster that, including whoever the caregivers are in the home, making sure that they have all the knowledge, information, and tools that they need to be an excellent caregiver as well.
Great. Thank you for that. I know that's extremely helpful for us to have, and not just for us as individuals, but if we are looking out for and supporting our our neighbors, our residents, our family members. So absolutely important to have that reminder. One of the things related to looking out for others and really sort of supporting each other through this, there is a recent program that was announced through the city of Oakland that is, let's see, I'm blanking on the name now. It is, it's related to recruiting volunteers, the Great Oakland Check-In is what it's called, the Great Oakland Check-In. And it's recruiting volunteers and training them on how to go through and call our seniors and our other otherwise sort of hard to reach sort of population, to engage them, check in and see what they need, how they can be supported through this crisis. And so I believe we had about 300 volunteers who were trained this past weekend. If there are others who are interested in getting the training and contributing in this way, I encourage them to look up, Google the Great Oakland Check-In and participate. I believe that we've identified, I think through that process, about 100 seniors who are eligible for meal distribution, meal delivery and distribution, and connecting them to that service through this process. And so by having a list of sort of folks to reach out to and really engaging them, that's a way for us to just make sure that those who otherwise aren't connected or plugged in have not only, I would say, the support, get a friendly call of someone who's interested in helping them out, and get connected to resources that they may not otherwise be aware of. So wanted to lift up the Great Oakland Check-In, and there is a volunteer link in the chat for this stream for anyone who is interested in that. Another question came in related to businesses. So what resources are available for businesses today? Are there online workshops for business owners, for parents, that sort of thing? I know, CJ, this is in your wheelhouse, and you have been really hitting the ground hard, engaging our business community, specifically in East Oakland, to help them access the resources. Maybe you can share a little bit of your thoughts, what you would advise.
Yeah, so there are a lot of resources. I would start at sort of the city level and checking with your city, the city business office, to see what workshops are available. Local chambers, Chamber of Commerce, Oakland African American Chamber of Commerce, Latino Chamber of Commerce, Metropolitan Chamber of Commerce, all have virtual sort of support. If you're in a particular industry, check out your industry association or professional association. They will be having different types of workshops. The Black Cultural Zone is reaching out to East Oakland businesses and Black businesses and artists and makers in Oakland in general, and providing a list of updated resources. There are probably 20 webinars a day on Zoom from someone somewhere, and so you can certainly access it that way. It is challenging to curate it, but I would start with chambers of commerce, your professional associations, your city business offices and county offices, to see their lists of things that are coming on. Reach out to your accountants, if you have an accountant, to see what resources that they have. But there's a lot of webinars and things. I think you have to also figure out what you need. So there's the rapid response resources, how to fill out a PPP. We just did a joint workshop online with Bay Area Organization of Black-Owned Businesses to actually do a group walkthrough of filling out the different applications. So those are those resources. There are resources that help you get your business online. The National Economic Alliance has a set. So we'll share a list of those resources on how to get market ready, how to create your website online, then there's sort of resources around capital, readiness, how to prepare your balance sheets and statements that are needed for these applications. And so if you don't have an intermediary, again, city and state, the Alameda County Small Business Development Centers as well are great resources. SBA, SCORE, those are groups that will have, and between those 4 or 5 resources, you will probably find the bulk of online webinars for any topic.
Great. Thank you for that, CJ. I think now is probably a good time to remind folks and mention the city of Oakland has a very comprehensive website around coronavirus response. And when you go to that website, oaklandca.gov/COVID19, COVID-19, it brings you to a central information and resource page. And on that page, you will see resources for residents, resources for businesses, resources for workers, resources for employees, testing related, et cetera. And so that is what I would refer to as kind of the central starting point that I would recommend everyone go to. And then based on who you are, what you're interested in, it serves up a set of resources and information available for you. I know that our Economic and Workforce Development Department, when it comes to businesses, has a survey that they have published so that they can better understand what our businesses are working with and struggling with and where help can be provided. Everyone who completes a survey gets an actual phone call, outreach and response. And you get added to the newsletter that has been coming out on a weekly basis, providing resources, additional grant information, and others as well. And on that page, there's also the opportunity to connect to organizations like the Black Cultural Zone and others that are providing those that training and those resources. So wanted to acknowledge that central sort of starting point for all information that is related to coronavirus and support for our residents and our businesses. Let's see, related to testing, I know that's a question that had come up. How, if you feel as though you have symptoms, if something is happening, what are the different avenues for getting tested and knowing for sure what's happening, so that we can be safe? We know whether or not we're at risk of exposing somebody else, et cetera. I know, so for testing, I know that the city of Oakland has set up a number of testing sites that are in parallel with that has been set up by our health system. So if you're a member of Kaiser or Sutter, et cetera, they have testing for their members. But for those who do not have or may not have a specific provider, the city of Oakland has set up a few testing sites across the city, and one of which we are most excited about is the first testing site in East Oakland. And maybe Dr. Noha, you can share a little bit about this most recent addition to our testing resource list.
Sure. Yeah. Well, it's the first testing site in East Oakland. It's also the first walk-up site, probably in the whole Bay Area, because most of them have been drive-through sites. And that was just really important because a lot of our community was not accessing the drive-through sites for obvious reasons of not having a car or, being too far or what have you. And so so we're really excited to have launched that this week. Yesterday, we performed 260 COVID tests. So we actually exceeded, our expectations. And I'm just personally really happy about that because it lets me know that folks really are taking this seriously and are concerned and want to get tested. And so I think that's excellent. I think one of the things that's probably the most important to mention is about the criteria for testing, which has been changing so rapidly. And so one of the things I always worry about is that, it's like 4 weeks ago, 6 weeks ago, you had to have been to China to get a test. Like, 3 weeks ago, you had to have symptoms and that, or had to have a fever, and to get a test. And so it's evolving quickly. So I don't want people to assume that they're ineligible for a test. Also know that your provider, like a Kaiser or what have you, they may have their own criteria based on the availability of tests But what I will say is that Oakland has done an amazing, amazing job of creating access to testing. And there's even some places that have some unused capacity, which we want to use it all, right? We don't to let any resource go untapped or unused. So we're testing at all of our sites. So for any of our patients, we do ask that you call ahead for a regular appointment, like at our 73rd MacArthur site or other sites. But for the walk-up testing site, you do not need an appointment. You can register ahead of time. We recommend that. It does speed it up, but you don't have to. You don't have to have symptoms. For us, really anybody can get tested. Our testing is Monday, Wednesday, and Friday from 10 to 4 at 9925 International Boulevard. Who we really want to get tested, if you have symptoms, please get tested. If you know that you've been exposed to someone who has it, please get tested. If you are in a high risk setting, like you were just released from incarceration, you live in a shelter, you live in a congregate setting or in a very crowded living situation, you can get tested. Also, if you're in a high risk category, you can get tested. And so high risk category is over 65 and or diabetes, high blood pressure, cancer, HIV, so some kind of chronic medical condition. So we really want folks to get tested, because this is really, when you start talking about relaxing the shelter in place and things like that, is really premature. And part of the reason why it's premature is because we've really tested such a small fraction of our population. So we really don't know what we're dealing with in its entirety right now. And part of the reason why I think there's some direction towards lifting it, in addition to the obvious around the economics, is because we aren't seeing our hospitals overwhelmed to the extent that we thought they would be. But I'll just say that, because the hospital has a bed available for you or a ventilator available for you, is not a reason to think that we shouldn't be concerned, right? And so just wanting to be really clear that we're still in the early stages of this, relatively speaking, and we really don't know what all we're dealing with. And so I think the first step was creating broad access to testing. And I feel like we're finally getting there here in Oakland. And so I think we should all take advantage of that to the extent that we can. But no question, if you have a fever, cough, shortness of breath, any of those symptoms that we know around COVID, loss of smell, loss of taste, get tested. It's not only for yourself, even if you're in a low risk category. It's a very unpredictable virus, as we know. People who we don't think are going to do poorly quickly, and they deteriorate quickly, and that is frightening. And then others who you would think wouldn't do well do just fine. But it's not just about you. It's about the people you live with, the people that you're around. And so I'll just briefly say that as we go further along this and we start testing people and people come up positive, we have to do what's called contact tracing, which means find everyone that you might have infected. And that's a lot of people, right? That's anyone that you were with for 10 minutes, or anyone that you stay with, anybody that you live with. So those are the people that we're concerned about. So not only yourself, but everybody around you.
Thank you for that. Absolutely. And we will be putting the link to register for testing into the chat, the chat screen, so that folks can follow that link. Also, via email, you can, if you have any questions, you can reach out to email address COVID19 Testing at oaklandca.gov with any questions that you might have. Also,
Sorry, Councilman, just because of the link, I wanted to, around registration. So the registration link that's being provided by the city is through the partnership with Verily, and they have a really amazing platform. It's very seamless, and you can get registered there, come in, get your test, and go. I just wanted to mention that for that, you have to have an email. You have to be able to be reliably contacted by email. You have to have ID. And we know that that's not going to work for some of our population. And so what we've done, and what's really unique about the walk-up site, is that there's also the opportunity to register through Roots. You don't have to become a patient, but basically we will be able to follow up with you in that way, whether you have an ID or not, whether you have an email or not, and we'll keep trying to reach you and trying to find you, and you can always find us. And so I think that there's that advantage of being sort of rooted within community organization that can do that part. So I encourage everyone to go through the Verily platform if it's the right fit for you. And if not, and you really want to be connected with a community-based organization for the testing, or you don't have an ID or email, etc., then there's that opportunity as well. And that can be both actually options for registration you can find on our website, which is rootsclinic.org.
That's great. Thank you for that. And that's why it's so critical to have our partners on the ground that are plugged in and connected to the community to make sure that we are troubleshooting how some traditional pathways may not necessarily work for all of us, but we've got to sort of uplift that. So appreciating you there. Relative to testing, I know we've got, I think the capacity that you have is 250 per day. Is that right, Dr. Noha?
Well, we did 260 yesterday. I would say 300 is probably our capacity.
That is incredible, and so greatly appreciative to have that. And I know that we are looking at potentially some additional sites in East Oakland, given the acknowledgement of the demand and the need to have pervasive testing, especially as we come out of the sheltering in place. And so I'm looking forward to having some announcements around some additional sites
I'll just
coming
add
out.
one more thing, since you mentioned that. Thank you. Is that if you have a car and drive-up testing is something that could work for you, I encourage you to do the drive-through testing. There are several sites that have a lot of open capacity to do the drive-through testing, and just want to make clear that the site at 99th and East 14th is a walk-up site. So it's very accessible and it's working very smoothly. Parking is a little bit challenging, so there's really no point of coming to park to walk up if you could drive through.
Great for acknowledging that. Want to acknowledge that we have about 7 minutes in our scheduled time and a few questions that are in the queue. So related to some of the technology gaps, digital divide questions, there was one that came out. Is there any chance of a citywide Wi-Fi, a public Wi-Fi? That is absolutely a great question. It is one that I have been in dialogue with our IT department and some others, I would say, since middle of last year in terms of what we might be able to do. And that's an issue well beyond just COVID-19 and coronavirus, but obviously exacerbated by that. I know there are renewed conversations on how we could do that and do that quickly. And so I'm optimistic that we will actually see some progress there. Unfortunately, I am very skeptical that it will happen before the school year is out. But I think a reasonable target would be to make sure that we have something moving forward with that addresses the digital divide as we enter into the new school year. That would be what I would push for, just being a little bit realistic as well. Let's see. Want to acknowledge that this is just the first of many sort of live streams that we anticipate doing from the District 6 City Council office, and one of which we are looking at in the next week, 1 to 2 weeks, getting that scheduled now, a public safety town hall. And so we will be able to hopefully pull in the representatives, those who are helping to make our community safer in a number of ways, not just with law enforcement, but violence prevention, other types of programming as well. So looking forward to that. And let's see, there was a question, with increased testing, are the new infection rates going up? How is the curve in our district? So unfortunately, we don't have district level sort of data because it's all sort of aggregated at the county level. And then when it can be reported out at a more granular level, it is when it doesn't compromise sort of the personal health information. And if we don't have enough patients, enough volume, enough activity, then releasing data at a granular level might expose somebody's personal health records and information for it might compromise those. So there's as more volume of information comes out, then I believe we'll be getting much more granular in terms of different geographies and that piece. Going through the list of other topics I wanted to be sure to hit on, I think the Slow Streets program is one that people have asked a number of questions about. The city rolled out this program whereby it identified certain streets that would be closed to through traffic, meaning only residents who live on those streets should be driving on those streets. And the intention is to create more space for folks to walk around their neighborhoods, not necessarily passing each other in close proximity on a sidewalk, but allowing folks to step out into the street and not have the risk of being hit by a car at that time. There were some challenges with respect to the rollout and communication, and I think the conversations I've had with our Department of Transportation have acknowledged the opportunities for improvement there. We have gotten mixed reviews from folks, but I would say the majority of folks who live on slow streets have acknowledged appreciating the fact that they are slower and that there's less traffic and that they can be out. There's obviously some challenges with respect to is it the right street? What's the sort of enforcement or making sure that those streets remain sort of to only local traffic? What I'll say is that we're gathering information, feedback from folks. So there is a website, Oakland Slow Streets. If you look up Google Oakland Slow Streets, you'll find that website. They have a survey that they're asking for folks to fill out to see what is appreciated, what's not, what can be improved. Also, if you specifically want your street to be a slow street, they're taking those requests as well, because obviously if it comes from the folks who are residents of that street, then there's going to be greater uptake and appreciation for it. So acknowledging that, Operation Home Base is another project that was recently announced and kicked off. The Home Base site, the city-owned lot on Hagenberger, off of Hagenberger, that site now has RVs on it to house our homeless population who are at risk for contracting coronavirus. So those who are medically vulnerable, above 65 years old, have an underlying health condition that makes them most at risk. And there is capacity for about 130 of our unhoused residents to be housed here with RVs that have been provided by the state to the city to accommodate that. There will be full services on site there, 3 meals a day, and other sort of amenities. And the goal is to, even though that's set up there, to help transition those residents into long-term housing. That's not a permanent place. It's meant to help to transition to long-term permanent housing. So wanted to acknowledge that launch of Operation Home Base. And with that, wanted to close giving each of you, Dr. Noha and CJ, an opportunity to have any parting words, parting thoughts before we wrap up for today. Maybe, I think, Dr. Noha, we've started with you all the time, so maybe we'll flip it and allow CJ to start off with just closing thoughts, remarks.
Sure. And just want to say that consistent testing and PPE and protocols for physical distancing is absolutely essential for a strong economy. And so that is our priority. I also want to just raise up sort of health and wellness and spiritual and mental health services as we get out of this sort of immediate response. There's a lot of reactions. The caregivers, the parents need respite and support, and we need to think about those resources as well. And just again, raising up equity and raising up the communities that are most at risk in East Oakland, Black community, Latinx community, and we need to take an extra special effort to do more than we've done in the past.
Thank you for that. Absolutely. Dr. Noha.
Yeah, I don't want to end on any kind of downer note, but I do want to say that we need to keep our guard up. We need to stay vigilant. We have no reason to believe that we are out of the woods in any way, regardless of what is being said about lifting shelter in place. We know that with gatherings and being in close spaces and going back into office spaces and workspaces, these are some of the most prevalent reasons for outbreaks and for spread. And so I just want us all to be mindful. I've heard it said in different ways that the first wave that we saw was of the more affluent. A lot of that had to do with because of international travel and things of that nature. And I think that that's bearing out. You know, I don't have all the proof yet, but just anecdotally, you know, most of the folks that were hospitalized were not necessarily within the safety net system. There is a lot of reason to believe that the next wave will be in our communities. Because of a disproportionate number of essential workers, frontline workers, people living in crowded environments and congregate environments. And so I'm saying that to say, don't let your guard down, be vigilant, be careful. We still have to act like everybody has it, because quite a number of people will. And you can't tell by looking at anybody that we already know a lot about asymptomatic and pre-symptomatic transmission. And this is something that we still don't know enough. So I like how you started, Councilman Taylor, with there's not enough information, and then there's too much information, and it's hard to know what to sort through. So in the meantime, just please be safe, stay healthy.
Absolutely. Well, I thank you for that. And it is my honor and privilege to be in a partnership with the two of you, along with so many others, and really not just bringing the information, but really bringing real solutions to help bend the curve and address the disparities that we see here in East Oakland. So thank you for that. I want to end on a positive note and just acknowledge, again, happy Mother's Day to the two of you. If this were in person, I would be giving you flowers. Now we've actually got some flowers that we'll work on delivering to you guys in the next 24 hours so that we can show our appreciation for your dedication to our community and also for coming on to the show, this show today. So I am really appreciative for you guys helping kick off this inaugural live stream, YouTube live stream, District 6. And for those who are listening online, definitely want you to subscribe. We will be looking at the comments in the chat and responding to those as appropriate, and looking forward to the next one. So stay tuned. Thank you, everyone, for taking the time today, and enjoy your Mother's Day weekend.
Thanks for having me.
Bye.
Bye.
Bye.